And whilst they're doing that, I'm going back to Carol White, who still has 5 hidden symptoms even though they finished her craniotomy. And they could, or she could collapse. Let's see, that could be unconsciousness. How do you find that out, by the way? A physical examination, okay. It could be a skull base fracture. So I'll also order a CT for her. Tachycardia. Heart monitoring. For that, hypotension and open wound on head. Hey guys, welcome to Unmodded Gaming. I'm the Unmodded Gamer, and I'm back with more Project Hospital. And in the last episode we got 2 patients at the neurology department. Wait, this is Mark White from cardiology. Carol White, who is now being brought to the ICU. And who needs a craniotomy. I'm going to put her on life support. Let's just make sure that is being done before they do the craniotomy. And I'm also gonna go down and have a look at the other patient that we had at neurology, who I thought was going to be or had a surgery performed on him, also a craniotomy, but apparently not. So I've now lost that patient. I don't know where he is, but I'll have a look at that. Traumatic brain injury, 6 hidden symptoms, HDU hospitalization. Craniotomy seems like it is done, but where is the patient in question? Ah, right, he is here on the, well, in the HDU unit. And he's gonna get some more things being done on him. And this is really a difficult situation because we have one patient, James Allen, who I will also remember here. Right, Carol White has been brought to the ICU, but we have 2 patients who are in a critical condition. That is Carol White, and that is, let's see if I can find him, James Allen. And the problem is, they both need to be, or to have a surgery performed on them. But they can only do 1 surgery at a time. And I believe we need 2 more doctors. We have Linda Thomas, who's preparing for a surgery. But there should be 2 more doctors here who are also, or who we are also going to need for that surgery. Those are people from the orthopedic department. And what were those peeps I just heard? We have Frank King, who is performing neurological testing on James Allen. Okay. And we have Linda Thomas, who is performing a craniotomy on Carol White. Okay, so it looks like the patients are gonna be okay for now. I'm not losing them yet. And I'm curious to see how this is going to turn out. I got the Doctor Mode DLC, and Carol White wants something. Hang on. Well, she is being treated. There are 4 hidden symptoms, and we've got another patient collapsing. And this patient doesn't have a diagnosis yet. But he is dehydrated. So we'll go ahead and give him some rehydration. He's being brought to the trauma center. And whilst that is happening, I'm going to have another look at Mark White, who has been treated for an aortic rupture, which means I don't need to keep a close eye on that patient anymore, because he is a low hazard patient. And we got a patient with an incorrect diagnosis. Well, how did that happen? Abdominal pain and frequent urination. Well, let's do some biopsy sampling and an MRI. Now let's get back to James Allen, who's doing a blood pressure measurement. And I'm pretty sure that when they do a CT scan, they'll find out he is having maybe internal hemorrhage and a skull fracture. So that patient is gonna be in for oh, wait, he's only hypertension. Well, that is a relief, because that means they don't need to perform another surgery. But it also means he's probably going to be fine, because it is pretty easy to treat a patient with hypertension. The only thing here is that we still need to find out what else he is suffering from. But since those are not life-threatening things, he is going to be, or we have time to figure that out. And we have an ambulance coming in. Let me see who that is. Someone with a liver confusion. Liver confusion happens due to physical trauma to the upper abdomen. Well, he'll be on his way to the general surgery department, and he will be getting some medicine for that. Here we have Charles Lopez again, who I would almost forget, but he has been brought to the trauma center, and we get another patient by the ambulance. I've also ordered some things for Charles Lopez, and we have someone with mitral stenosis. Mitral valve stenosis is a narrowing of the heart's mitral valve that causes improper opening of the valve, and thereby the blood flow through the valve is reduced. And we got Elizabeth Hernandez, who is fainting. Let's gather some oxygen therapy then, and we'll do some things like a heart monitoring, an echo, physical and neurological testing for now. Right, so I'm pretty sure Charles Lopez over here, by the way, an employee who's leveled up, okay, But, as I was saying, I'm pretty sure Charles Lopez over here has fistula of the intestine. A fistula is an abnormal anatomical connection between two hollow spaces, and it requires abdominal surgery to be dealt with. But hang on, I don't want to do that, I want to do that, barium swallow. Because if he does have fistula of the intestine, which is usually the case when my patients come in with like abdominal pain and all this bloating and diarrhea, but they just cannot find the cause of the symptoms, it is usually, not always, usually fistula of the intestine. So I'm now going to check and see if he is suffering from that. And whilst they're doing that, I'm going back to Carol White, who still has 5 hidden symptoms even though they finished her craniotomy. And they could, or she could collapse. Let's see, that could be unconsciousness. How do you find that out, by the way? A physical examination, okay. It could be a skull base fracture. So I'll also order a CT for her. Tachycardia. Heart monitoring. For that, hypotension and open wound on head. So I'll also make them do a blood pressure measurement, and we'll see what else she has got, because this doesn't look good. And let me now get back to James Allen with the CT scan. Although it doesn't look like that CT scan is going to tell us much about the patient. And I forgot to remember this patient over here. Mitral stenosis, cardiovascular surgery. Okay. So she is going to the HDU. And we'll see when she collapses. And we have Charles Lopez again, being brought to this X-ray room over here for a barium swallow, and I'm curious to see as to what it is. So hopefully I'll be able to stay with him and look at the symptoms or the test being done to see if he has that or not. And we got a new symptom, brain hematosis. Well, I don't know what that is, but let me have a look here. Right, a CT scan has discovered both an epidural and an infracranial hematoma. Okay. Well, he has already had craniotomy, so that is no longer a problem. Right. Well, this looks glitchy. She was all in Charles Lopez. Okay, let's see. Because if this comes out empty, I might have to do some microbial sampling and a CT angiography. This is diagnostic imaging modeling creating detailed images of the intestines by injecting intravenous contrast after the patient has ingested liquid contrast. And it looks like this hasn't given us any further results. No, it has. just as I suspected. Fistula of the intestine. Well, I'll be handling that patient back to the computer. And I'll also have a look at Elizabeth Hernandez, who is waiting for the surgical team. That's cardiology. So that had been taken care of. And here we still have Carol White, who has abscesses. What is that? Buildup of pus within the tissue surrounding a surgical wound. Incision and drainage. She's getting her CT scan done. Alright, there she is. Well, let's have a look at that too. And see if we can find something like a broken skull. She isn't unconscious. It looks like. And she has a skull base fracture, but it looks like she still has at least one more symptom. Yeah, I wouldn't be surprised if she had tachycardia. And like I said, a skull base fracture. She needs a fractured neurosurgery of her head. Let's go back to Elizabeth Hernandez for now, who is being treated. Good. I don't need to worry about her anymore. And let's see James Allen. Well, James Allen isn't in danger of collapsing, so I can let go of him also. Which means we only have Carol White left to worry about. They're doing an incision and drainage. And they're going to perform a fracture neurosurgery on her head. Transport her to treatment. And she is treated. And I'm curious to see what they're gonna do first. The neurofracture or the fracture neurosurgery on the head, or do a heart monitoring and a blood pressure measurement. So My patients are actually doing surprisingly well, and they're going to perform a fractured neurosurgery on her head first. So that means that they're not going to check her heart rate. And now she is collapsed, or she has collapsed. Right, it looks like she is stable again. Well, let's just not do that. Let's go for the heart monitoring first. Because when they give her something for her heart rate, that is one less reason for her to collapse. Just as I thought. So just give her some medication for her tachycardia and then a skull base fracture or fracture neurosurgery head. But we are not going to look at that in this episode, because this is the end of this episode, which means that I'm going to say thanks for watching, subscribe for more. This was the Unmodded Gamer, and stay unmodded.